Hi, welcome to Health Center. I'm Dr. Gerald Dees, and today I'm going to talk to you sitting at home or laying in bed, whatever you're doing, about just generally medical care. It seems like medical care, the revolutionary ideas in medical care are completely different than when I went to medical school as such, because they're taking the person wholeness into the picture rather than just a disease. A disease is dis-ease, but that dis-ease can take place any part of your body, all the way from your brain down to your big toes and things like this. But not only that, but how do you get good medical care when you have a pain or you have a condition, a medical condition? You want to have somebody you can relate to, because touch, spoken word is much more powerful than just reading it out of a book. But you go into a doctor's office, for example, you want to feel very comfortable to be able to express yourself. There's so many things the mind does to the body when it's under stress. And stress is a terrible thing. Stress is a mess, in other words. So today we're going to be talking to someone who's in this whole department taking care of the body, all the way from the community where they live, to the foods that they eat, to the body that they contain or deficiency they may have. But at the same time, a healer. Dr. Vincent.
Dr. Dees.
It's so nice having you. You know, we go back a long way, of course. And as you sit here, it doesn't seem that way because you don't look like you could be that old. See, and if they look at me, they say, oh, yeah, it's that old Dr. Dees. But maybe just we could go back just a little bit about when you went to York College and what happened from there all the way to coming at Downstate Medical Center now, head of a program to show how we as doctors or physicians should be taking care of people.
Well, as you know, I did attend York College City University, where I studied chemistry and math, and I got to work with you in community medicine. I thought I might want to be a doctor. There were no doctors in my family, but I realized how much our neighborhood, South Jamaica, Queens, needed primary care.
Right.
You were the only doctor in the neighborhood,
Right.
really. You know, it was really, if you had something wrong with you, you had to go to a hospital emergency room, and the care just wasn't good.
Or a house call.
Or a house call, forget that, except for you. And so it took a while, but I really thought, especially after I worked with you, that I wanted to be a doctor. I wasn't really sure after we went to Triborough Hospital, and I saw those surgeons standing there saying AK, BK, where they were going to cut those people's legs off who had peripheral vascular disease, trouble with their circulation. Yeah. I said, well, maybe this isn't for me. Let me see. So I spent some time teaching, as you know, 10 years junior high school, finished my master's degree in electron microscopy, went on to teach graduate school, and then my father-in-law got ill. And when he became ill, nobody could diagnose him. I figured out what he had, and we turned to you, and we got him some care, and he did actually quite well. He had diverticulitis with obstruction and abscess. And I applied to medical school here, and I was lucky to get in, and it would just change my life forever. I loved medicine, and I loved people, and I did what I always wanted to do, which was go into primary care, family medicine. I would go on and chair the department and build the Department of Family Medicine here for 22 years. And in the process, ended up also finishing a PhD while I worked in molecular and islet cell biology, so I could better treat my patients with diabetes. And then, around 2008, when things were starting to go wrong around here, I went to law school at night. So I'm a lawyer and a doctor and a PhD. And medicine has really taken off technologically. So we know a lot about molecules, and we know a lot about our understanding of diseases has really just skyrocketed. But what happened along the way was that people got lost, and the importance of the relationship with the patient. And so along came a program called DSRIP, Delivery Program, where you deliver a new kind of care. You transform medicine so that you can use the new technology, but you make the patient at the center. And that relationship with the patient and the preventive and primary care the patient becomes the important thing.
Right.
You're following evidence-based care. You raise the quality of care. And this led to an idea called Delivery System Reform Incentive Payment. So the federal government had all this money left over from doing managed Medicaid, and they sent it back to the states and said, change the way you're delivering care.
All right,
Use
surely.
the technology,
Surely.
but have that, work in teams,
Surely.
have that relationship with the patient,
Surely.
follow the best evidence we have, and see if you can change the healthcare system. And there's a lot of reasons for doing this. For example, out of this DSRIP came 25 organizations called PPSs, Preferred Provider Organizations or systems, who implement this transformation. So we start these projects, reaching out to people who have no insurance and hooking them up with primary care, or going into children's homes who have asthma to identify triggers, what's kicking off their asthma,
Right.
how can we better treat them, how can we use the computer. We came up with this asthma action program that we use as part coming from the American Lung Association, where it's easy for patients and their parents to understand. Are they green, doing well? What medication? Are they yellow and getting into trouble? And just from breathing in the tube, you could help the patient understand where the child is at and how to better treat them. Or is the child really in trouble? They're in that red zone. So, you know, using technology, putting this into the electronic health system, but doing it for the patient, giving it to the parent. These are the things. And, you know, there's a good reason for why we have to do this.
Oh, sure.
You know, we know, especially in New York City, things go on that don't go on in other places. You know, for example, we come out of South Jamaica, Queens. Do you know right now there are these big old garbage trucks and solid waste and municipal trucks parking on 180th Street every Saturday morning, and people come and hose the trucks down, and they're full of all this mess, and they're hurting our children, and we're trying to fight to get this to stop. You don't see this happening in Great Neck. You don't see it happening in Manhasset, but it happens in South Jamaica, Queens, and it affects the health of our community and our children.
Well, let me tell you this, though. You don't have to go to South Jamaica. Right outside of Downstate,
That's right.
there's garbage trucks
Yes.
that do the same thing, spray those trucks and that stuff. It is air conditioners all over the outside of that hospital, right in front of there where they do the
Sucking
spraying.
it in.
They're sucking it in, and they wonder why they get infections after surgery. That all that decayed material in those trucks are coming in there. And I had a student, in fact, test where the bacteria at. She went from the truck and she took samples along her footsteps into the hospital where she was at, and she found the bacteria on the bottom of her
Sure.
feet, walked right into the hospital.
Bacteria, toxins.
Sure, toxins.
And the problem here is, and we had the same issue, by the way, right at Lefferts Avenue, 840 Lefferts Avenue. Every day they'd be coming and washing down the garbage trucks right in front of our health center.
That's right.
Do you know what I did? I called Mayor's office and spoke with Bloomberg. Mayor Bloomberg, God rest him, you know what he did? Next day, no garbage trucks.
Right.
I told him, look, it's not only the bacteria, it's the toxins, it's the poisons.
Oh, yes.
So there are things in the environment like good food and a nice clean house and having a place that's free of toxins and bacteria that promote health. But then there's things that make you sick, and that's an example of something making you sick.
What I did was I called the Daily News, and Channel 5 I called, and they came down with their cameras, and they took pictures of the truck, and they took pictures of the puddles.
And what happened?
Around the truck.
They stopped it?
They did. That's why they don't wash those trucks anymore. But I had to do that. I'm saying that doctors have to be in charge of something to have it to happen. You just can't say, here's the problem. Unless you stay with it and can bring in city things where we can they can make the identification, and they're going to be held responsible if they don't do something.
Right. And it's not the truckers.
No.
It's the people in charge.
Of course.
Because, I must say, the police precincts down in South Jamaica, the 103 and the 113, they're coming, they're ticketing the trucks, they're towing them away, but it's the price of doing business. They just come back and wash these filthy trucks. They're getting our children sick. So, you know, you still have your contacts at Eyewitness News or 7 on your side,
No.
because that's the kind of stuff you have to do to make an environment healthy.
I had to do the McCurry report, and the McCurry report I did for 10 straight years, a show every Sunday. I did over 1,000 shows, and for example, when I was on the Argo starch thing, where I was getting women off of Argo starch, when I took the cameramen into the little bodegas in the stores, they had the Argo starch among confectionaries, crackers and things like that.
Tells people they could eat it.
Yes, rather than in the cracker, in the laundry area.
That's
because the
right.
laundry area sucked up those chemicals and made the starch inedible. But once you could eat the starch and just chew it between your teeth, they did it for 90 years. Women did it, ate Argo laundry starch for 90 years, carrying babies with hemoglobins of 9 rather than 15, because the baby was getting not the nutrition through the whole placenta with the blood and things like this. So once they did that, the whole company's out of business now. The whole Argo starch is out of business.
Can I tell you something?
And unless you are, as a doctor too, you got to be an activist. As you have been yourself with your residents and things like this. It's not just identifying the problem, but get rid of it.
How do you solve it?
Yeah.
And you know, those women that were pregnant eating Argo starch, not only isn't the baby getting nutrition, nor is the mother, but when the mother is that anemic, the baby's not even getting the oxygen they need.
That's right.
And you know, and this affects the health for the whole life of that child into adulthood.
Low-weight babies.
That's right.
Which gives way to diseases and
trouble
things like
in
this.
school.
Trouble in school. Well, you know, like you lived in the same neighborhood I did, so on those little corners where they sold the little quarter water drinks.
Oh, Lord.
Now those quarter water drinks.
They used to
they
be a
only cost
nickel.
a quarter. Yep. Well, then they got to be a quarter, but they were just nothing but sugar and dyes and
Sulfites.
additives and
Sulfites. Bad.
You know, to keep the colors together, they had to put sulfites, which caused asthma.
That's right.
So here these little black children go into the emergency room in the middle of the night with a breathing thing. And a parent, to stop them from going to the emergency room, gets a little pump for them so they wouldn't have to get out of bed. But that pump that Medicaid didn't pay for cost $40 a pump.
That's right.
And they didn't have $40 to go to the drugstore and get that little pump. So they would have to be up with that child all night or come to the emergency room and sit there all night. You know.
And all because the child had a little quarter or nickel water drink with sulfites in it.
But not only that, the colors in there also affect the brain, because they found that the IQ of these children have been lower. Now, now, the trouble we're having in schools today with these young children, behavior problems and things like that, it's all hooked up with the environment. Not just diet, but the whole environment, like you say. But they have to have doctors who are trained to recognize this, to rather than give it a prescription, to give, here, go to this store and buy these kind of foods.
Stop polluting our environment and our children.
That's right.
Because the cost of doing business may be that ticketing and towing those trucks.
That's right.
But the cost of our children getting leukemia, lymphoma, having asthma, not doing well in school, that's too high a cost to pay.
It is. I found that, and the sanitation is a prime. You know, if you don't have sanitation and good nutrition, you have to have good nutrition. If we can't have Whole Foods, for example, people are lined up now in front of stores called Whole Foods, because these foods supposedly have taken another food, substituted that might be the same, but have taken out, say, ingredients that might cause a problem.
Well, you know what it is? I think folks really want to be healthy, and they look at fruits and vegetables as a path to it, and they're right.
Sure.
But there's other things that we have to look at. You know, we have to help change our environment. We have to be agents of change.
Sure.
But we also have responsibilities to be able to connect with patients, to be able to have a new way of delivering medicine that's really acceptable to patients, where the patients are making the decisions.
Sure.
So you put it in the patient's hands. And there's a whole bunch of projects we're working on, from asthma to cardiovascular disease. So if you come to me, I may say, you know, you got a problem with your high blood pressure, and you got a problem with your cholesterol, and you know, you're not taking your high blood pressure medicine, you may be smoking, unfortunately. And I can actually now use technology to go into my computer and say, well, your chances of having a heart attack or a stroke in the next 10 years is 50%, and say, how do you feel about that?
Right. Sure.
You know, most patients will say, I'm not happy. You say, instead of saying do this, you ask the patient, what are you willing to do? What do you want to work on?
But in order to do that, you have to know what's inside of a patient's home. And that's where the house call comes in. And doctors have decided that they're not going to make house calls. You're going to come to my office or to the emergency room. But when you do that, for example, I was going at home where, when I was on a McCurry report, we went into the bedroom. And I showed 10 things in the bedroom that caused asthma.
That's right.
Everything from mites in the mattress. How old is your mattress? 25 years old. You can bet there's millions of mice in that. Mites, M-I-T-E-S, not mice, M-I-C-E. But when they eat the skin, the flaking oil off your body, they defecate, they move their bowels. That becomes mite dust. So that mite dust is now in the mattress, and the mite dust comes up and you just turn over and then gets into your respiratory system and you wake up with asthma. Or the pillows. I've seen pillows on the street, $5 a piece because it was decorated very pretty. You should never buy a pillow that doesn't have a zipper.
That's right.
Because you got to know what's inside that pillow. If you buy a pillow for $5, it's junk in there. It's all kind of moldy stuff. And people lay their heads right next to that. Children lay their heads next to that and wake up with asthma. So pillows, it's just in a bedroom.
Mold on radiators.
Oh, sure.
Mites in rugs.
Rugs, oh yes.
All kinds of stuff.
And when you walk on a rug, or even with bare feet, of course, you pick up the mites and you put them right in your bed. Mites are all over the floor from the street. And I don't know, you go into a bathroom when you can't, you're out having a good time, you have to go to use a men's room or something. The stuff around the bottom of those urinals are unbelievable. That's on the sole of your feet.
And they're not so clean.
They're not so clean. Ain't disinfecting nothing.
But you know what? There's people living on the street, and that's all they have.
Oh, yes.
It's we don't understand. We're beginning, I think, to really get a grasp on how important the environment is to a person's health.
Of course.
Less stress,
a
clean environment, one that's free of toxins and bacteria, one that promotes health.
Right. But to get people to read some of this stuff is hard because they don't have, it's not advantageous to go and pick up a little pamphlet. I started a program called Balm and Gilead Health Lines, where I write for different newspapers, Daily News, Amsterdam News. I would take those same articles and I would put them up I would send them to churches. I would send to churches 4 pieces, and some of my articles too, a month, and they duplicated 1 piece. And Sunday morning, part of the service, they would have a young person who was interested in nursing and medicine to read that piece while the person was sitting there looking at that piece. There, at the end of a year, they would have 50 pieces of health information off the pulpit. And that's a much different delivery. So delivery of information.
Trust. This is true.
And trust.
People have to trust you and know that you want them to be doing well.
Well, that's right.
That's part of caring.
And
also.
where do you get, you can do it in schools, but where do people collect? I don't care if it's a storefront church or a cathedral. If you can get those people to read 1 piece of health a week, can you imagine 50 pieces of significant things that they should be aware of? Not long book, significant ones. Stick to 1 little piece each week. 52 pieces of health information is
a lot of education.
A lot of education,
I think, creating the environment for people to be well, creating a system for folks to feel comfortable to get their health care, putting the patient in charge, delivering a quality of care, using technology in a new way, and transforming healthcare to get better results is what DSRIP is all about. And it's funny because, you get the feeling that you've been around a long time, and Dr. Dees, you've been around for decades, and you feel that, well, part of the art of medicine is lost while we've taken off with the technology. But what DSRIP is really about is keeping the technology, but going back and putting the patient at the center of medicine and really working with that patient in new and different ways to improve healthcare outcomes.
Right. Well, the things that when you can present something to people in a way that they understand it. It's so, like when I used to make house calls, before I left the house, and the patient would be right there, I'd open the refrigerator. And I would see in the refrigerator, out of the 10 things, 8 things, they shouldn't be there. That's giving them a problem. And they wouldn't mind me going in the refrigerator and say, you got to get rid of this, you got to get rid of that, you got to get rid of it, because this is taking you to the emergency room and so forth.
Or show people that their yogurt has too much sugar in it if they have diabetes. Now, people think all yogurt is healthy. Maybe not.
Yeah, right.
So it's those, it's the little touches. And people really do appreciate that.
They appreciate that.
And people appreciate the fact that you care, and you've spent a lot of time caring for folks.
Well, I used to go to their closets, for example. Now, everybody likes to have a clean smell. There ain't no such as a clean smell because it smells, So they had these cans in there that they can spray a clean smell. This will make your house smell like roses. And so these little bent dancing molecules come out and it dances in the air. As it dances in the air, you go right in here,
there goes
down into
your
your lung,
Not
and
good.
there you got asthma.
Yeah.
And people, they have fooled people to say, well, I'll put this on my wall, and it will automatically, with a battery, charge and keep the air
Just
smelling like
open the
roses.
windows and vacuum the rug already. That's all you got to do.
That's right.
Or if you want something clean, take it and shake it outside on a sunny day.
But I'm serious about that.
I am too.
As you know, because those molecules that you spray into the air do
breathe
not
in
go
them.
against the wall or in the ceiling. They call what they call browning in motion. They stay in the air like this, and you're smelling that stuff next week.
Yeah.
If you're smelling it next week, those molecules are there for next week.
And they're in your lungs,
and
too.
they're in your lungs, you see.
Yeah.
And look how long it took them to take cigarettes and say, every time I go to school and I pass a cemetery, Evergreen Cemetery, and it's massive, I could say almost half of those gravestones are due to smoking. And look how long it took them.
But patients still smoke. And how do you help them to stop smoking?
That's
so the
right.
new medicine is about empowering patients.
Surely. And the thing is that, and getting to the companies that are producing these kind of things.
You see, that's the issue, because they're going to make money off of folks.
I understand.
And there's no more money than they make off of our poor folks who don't know better. And that's part of education, is part of what we do.
Well, the amount of disease or dis-ease that's causing these kind of things is just unbelievable. But time is our enemy, Dr. Vincent. You have presented you're on the front lines of this whole thing of new medicine, how to keep people well. Just a statement from you, how we could make people live longer and happier.
I think, if people treated each other the way they want to be treated, and if they're good to themselves, people know what they're supposed to eat. Mm-hmm. People know they're supposed to get some sleep. Mm-hmm. And if people are just good to each other, it would make a really positive effect on the way they feel and on their health. Right. Get some exercise, get your sleep, and take good care of yourself and your family.
And now, just one other thing. How do you think the medical student who stays in 4 years in a medical school and never gets this whole lesson taught?
Well, they get it taught, because we all teach medical students. When I'm seeing patients on Wednesday afternoon, I almost always have a student.
That's you, but I'm just talking about, I went to medical school here just like you did. I did not have a course to talk about environment as being part of a disease.
No, but now they do give courses. We have a School of Public Health, and they talk about the environment and disease, and you see patients, and you see what our patients are exposed to, and you kind of understand where the diseases are coming from. Some come from their genes and their family, but a lot more disease comes from the environment and the social determinants of health than we have given credit for. But it's still, everything old is new again, so don't give up. Don't give up, because we're using that technology and now taking it back to the patient.
But you know who has made a big difference? The visiting nurse service that's been in 100 years in the business of going to homes with that little black bag. The visiting nurse should be given wads of money to carry information into that home because they're making that house call that doctors don't want to make. So use another system.
I still make house calls.
I understand
Family
that.
doctors still make house calls
But,
by and large.
Try to get one if you could leave, not you, but try to see, call up somebody at night. They'll tell you call 911. It ain't no house call. It ain't no house call. You know, so therefore, I think we learned a lot today, and you're on the right track of what you're doing in the department that you now have established here at Downstate, and they're going to be having a whole new way of delivery of health care to keep people out of hospitals.
That's
and
right.
that big hospital bill. So
That's right. And everything old is new again. We're going back to the patient.
there you go.
It's a pleasure as always.
Always. Right.
Thank you, Dr. Dees.
Okay.